Hi Cheryl. The question is, I do have osteopenia, diagnosed a couple of hours ago. And as you know, osteopenia is early stages of osteoporosis, which is a bone issue. Recently I've started getting a pain in my left hip at the back, and can some mornings feel like it's onto my lower left back as well. I thought there may be a way I slept, but not sure. Could you shed any light or advice of what to do, please? So I'm going to focus on two things. I'm going to focus on the hip issues, and then I'm going to focus on the osteopenia, which is early stages of osteoporosis. So the hip issues. So generally when there's any dysfunction or discomfort around the hips, what it's showing us is an emotional instability. So what I'll be asking yourself is, where do you feel emotionally unstable right now? Then after you've answered that, I'll be following up with, how can I change this right now? Once we can move you from emotional instability into emotional stability, that's going to really support and help with your hip. Then we're going to look at the osteopenia, or early stages of osteoporosis. So what this actually is, in an energy form, is excess nuclear and excess electrical energy in the body. Now, we go through stages in lives where we've naturally got certain energies in our body, and as humans, we have our own body designs and naturally have different particular energies or more of certain energies naturally in our body. So when we're looking at the stages of life, what we're looking at is from 0 to 16 years old, we have naturally more of mechanical and chemical energy. Then when we go from 16 to 50 years old, we naturally have more chemical and radiant energy. Then we hit 50 plus, we naturally have more electrical and nuclear energy. So osteopenia and osteoporosis is quite common with people who are 50 plus years of age. Yeah? And now what we need to do to prevent this is make sure that that natural energy that we're having, the electrical and nuclear energy, we balance out physically with the foods that we're putting in our body. So we're bringing in mechanical energy, we're bringing in chemical energy through the foods that we're putting into our body. So the way we want to do that is we want to look at foods that are astringent, bitter, pungent, and a little bit of natural sweet foods. If you want to focus your nutrition on those types of foods, so pungent, astringent, bitter, sweet, natural, yeah, this will bring more mechanical energy and chemical energy into your body, enabling to get more fullness into your bones so your bones don't deteriorate. So the electrical energy and the nuclear energy isn't drying out and weakening your bones. Yeah, so the answer for you around this is to really focus on those 4 types of tasting foods to put into your body. The pungent, the astringent, the bitter, the sweet. Now pungent, I wouldn't have too much of pungent foods. So pungents are the really strong foods. Yeah, include them in your nutrition, but don't have too much. Focus on the other three. Focus on the astringent, the bitter, and the sweet types of foods. So what we're looking at is root vegetables. We're looking at beans. We're looking at rice. We're looking at seeds, nuts, juicy fruits. We're looking at salt, milk, dairy. They're the main types of foods that you want to look at having for yourself. And I also want to suggest applying ashwagandha oil to your bones 2 to 3 times a week. Now, ashwagandha oil is great at moisturizing, getting through the skin and moisturizing the bones. It releases and reduces pain, yeah? And a lot of people with arthritis and osteoporosis use this to reduce the pain, to give moisture back to the bone, so then it's not affected and it balances out the excess electrical energy and nuclear energy in the bone and in the whole body. So ashwagandha oil. I suggest putting it over your whole body, but as a minimum, just put it over where your bones are, which is your whole body anyway, 2 to 3 times a week. Now, if you'd like any more support with this, I do one-on-one intensives where I can actually support you with healing and doing these treatments for you. I do retreats where I do the same thing. And I'll also do courses where I can teach you about these things so you can be able to support yourself better and even support those around you if you choose to. You can simply go to www.uniquecommunity.com.au, check out our experiences page, which will have all the details there. I look forward to hearing back from you after you follow these processes to hear about the great news and how great things are going for you. Until then, take care. Quick disclaimer, I'm not a doctor. However, I have doctors that support me on the other side. So when I can see dysfunction in your body, they support me to understand what the dysfunction is and also how to treat that dysfunction. I also tap in to my studies in Ayurvedic medicine to support with understanding the dysfunction and how to treat the dysfunction. However, if you have any concerns, please don't hesitate to go and see your doctor as the first point of call.